everyone, we are Team 10. Let me first introduce our team members. Tendal, Urmila, Shweta, Varsha, Tarun, Vivita Harini, Udaya and Shweta Shri. I'm Arunika myself. And today we are here to present Alkaptonuria. So let's start this presentation with a case. A 42-year-old male presents with complaints of back pain and knee pain. His ear pinning sclera shows black pigmentation, and skin of both the palms also shows blackish pigmentation. And urine turns black after a few hours on exposure to air. And now, the X-ray spine shows narrowing of the intervertebral discs and lumbar lordosis, which is the inward curving of the spine. So let's see what's the probable diagnosis. It's Alkaptonuria. So what is Alkaptonuria is that it is an autosomal recessive condition in which homogenetic acid is accumulated in the body and it gets excreted in the urine, which causes its iconic black color. So this is a disorder of the tyrosine metabolism. Normally what happens is tyrosine gets converted to para-hydroxyphenylpyrrolic acid, which turns to homogenesic acid and then malonyl acetoacetic acid. This becomes fumarate acetoacetic acid and eventually enters the TCA cycle as fumaric acid and acetoacetic acid. So this is a normal condition. What happens in homogenesic acid is that there is a mutation of the gene, so which controls the enzyme that is being produced. So since this enzyme is deficient, the enzyme homogenesis dioxidase is deficient. So essentially a superhero is being inhibited. So what happens is that homogenesic acid can't be processed. It will accumulate in the body and the excess will be excreted in the urine. This is the urine. With this, on exposure to air, turns black in color. This is essentially like spontaneous oxidation in which homogenesic acid will be converted to benzoic acetate. This on polymerization forms the alkyl bodies, which will deposit on the connective tissue and the joints of the body, which results in ochronosis. And now Urmila here will discuss the clinical manifestation.
So we've decided to represent the clinical manifestations through a spin the wheel. So first is blackened urine. So the homogenesic acid, because it gets accumulated, is excreted in the form of urine, which on long-standing turns black. Second one is cardiomyopathy. So basically the homogenesic acid gets accumulated in the coronary arteries as well as the heart valves, due to which cardiomyopathy occurs. Third one is ochronosis. Ochronosis is basically the hyperpigmentation of the sclera as well as the pinna of the ear. So alkapton bodies basically get accumulated, which leads to the blackish discoloration. The next one is arthritis. So basically the homogenesic acid gets accumulated in the joints, especially the knee joints, hip joints, which leads to the cartilage cells being destroyed and the bones becoming brittle. Last one is discolored sweat. The homogenesic acid is, because of its excess accumulation, is excreted through sweat, which on long-standing turns black.
Next, about the treatment and diagnosis. First of all, about the diagnosis, unique diagnosis by black urine test. So, on stagnation, urine turns black because of the presence of homogenic acid, which turns alkaline on standing. Then, we shall use the Benedict test because homogenic acid is a reducing substance. So it gives positive to the genetic test, Benedict test. And about the treatment, there is no complete cure for alkaptonuria, but we can reduce the symptoms by limiting the phenylalanine in our diet and by using NSAIDs and other medications to relieve joint pains in our